Welcome to India TV and you're watching Health DNA with me, Anshu Jaising, and today we have with us Dr. Saumya Mittal, Head Neurology from Sharda Hospital. So welcome.
Thank you.
Sir, what is Alzheimer's disease?
Alzheimer's disease is basically a condition where we commonly have a problem of memory loss. The patients who have the complaints of Alzheimer's disease, they usually have loss of memory. These patients are usually of elderly age group. They are usually of age group of 60 to 65 and above. Of course, now we have a younger age group who is also having Alzheimer's disease. But commonly what we know, what the people know, if there's a memory loss, they believe it's an Alzheimer's disease. So that is a common disease that we have. As the Indian population is growing, they are aging, this disease is becoming more common. A lot of people have this problem and the population is facing these issues.
So what causes Alzheimer's disease?
Alzheimer's disease is basically caused by shrinking of the brain. As the person ages, the brain shrinks. Now, to a certain extent, this is normal. But in Alzheimer's disease, almost up to 20% of the brain can shrink. So when that happens, a person develops the loss of memory. And there are other symptoms also, like a person will have a difficulty in calculations. A person will have difficulty in understanding where he has to go. But the people in general, they feel that yes, if a person has memory loss, they have Alzheimer's disease. That is a common symptom. But there are other symptoms.
So, sir, are there different stages and the signs and symptoms are different in every stage?
Now here we have all the symptoms, can have memory loss, can have a difficulty in geographic location, can have difficulty in calculations. All the symptoms can be present. But the symptoms are so mild that a person does not have a difficulty in working. They will not lose their functions, they will not lose their ability to work on a day-to-day basis. As this progresses, the condition will become worse, and there's a stage where a person is not able to carry out any activity. They'll not even be able to understand what is being said to them. They'll not be able to communicate, they'll not be able to feel much. So that is another stage of Alzheimer's disease that can happen. So definitely there are different stages of Alzheimer's disease, and it slowly progresses. Like we said that the brain, it shrinks. So it does not, the entire brain does not shrink at one single time. It starts from a particular location in the brain and then it keeps on expanding. Now as that expands, as the brain, the shrinkage, the area which is shrinking expands, the problem and the symptom complex also increases. So when you have a particular area of the brain which is shrinking, so it will have only that much of symptoms. As that area increases, the symptoms also increase.
So how important it is to detect early?
It is very important to get it detected early, and that is because we have a very restricted amount of treatment as of today. And for that, it is very important that we try to get it, treatment should be started fast. Because if we detect Alzheimer's disease in an advanced stage, then it will be very difficult to treat it. What we have today for a treatment is something which slows the progression of the disease. So if that is started in the mild to moderate stage of the disease, it will show a better response compared to if we start the same treatment on a severe stage. Because starting it in a severe stage, already the damage has been done. So once the damage has been done, we are not going to get a good result of the treatment. So definitely if we get it, if we start treating the patient in the early stage, we get a better response.
So are you saying there are proper treatment for this thing?
There are restricted treatments, I would say, but yes, they have to be started early. I'll not say that we can cure Alzheimer's disease, but we can definitely do something to help the patient. Besides the memory loss, there are conditions where the patient can develop hallucinations, they can develop delusions, they can develop psychosis. So these symptoms also have a specific treatment and they do give us a very good treatment.
So are there any tests?
The best test for Alzheimer's disease would be a test of the memory, what we call as neurocognitive testing. That is the best test. Here we interview the patient in detail. It takes almost an hour to 2 hours if we are doing a complete study, and that gives us the best response. That gives us the best result as to where we have the damage. So because the area which is damaged, that area is what we can pick up with this test. Thereafter we can diagnose, because Alzheimer's disease, like we said, is not the only disease. There are other conditions like frontotemporal dementia. There are other conditions like Lewy body disease. There are other diseases which are close mimics to Alzheimer's disease. So in each of them there are specific areas which are affected, and that differs. So with this we can pick it up that which kind of dementia are we dealing with, and that helps in changing the diagnosis, and that helps in changing the treatment. Besides that, we do have MRI brain, we do have CT scans, we do have EEGs, and we do have a lumbar puncture test. But all of these tests are basically to rule out something else.
Okay.
That we are not dealing with some other condition like subdural hemorrhage, a brain tumor, maybe a brain infection. So these are things which we need to rule out, that yes, this is Alzheimer's disease for sure and not something else. So to a large extent it helps in diagnosing other conditions, ruling out other conditions. The area which is getting restricted can be picked up on the neuroimaging like the MRI and the CT scan, but that is a restricted window. But to a large extent it is a neurocognitive testing. Now recently we have started using PET scans for a diagnosis, and that also is giving a good result as to how the diagnosis has to be made for the Alzheimer's disease and other differentials of the Alzheimer's disease. But the best testing would still be the neurocognitive testing.
So how prevalent is Alzheimer's disease today?
See, Alzheimer's disease unfortunately is one condition where we are missing out on a lot of diagnosis, because to a large extent we feel that the patient is probably having the symptoms because of age. So to a large extent a lot of people are not coming to the doctors because they are considered to have the problem because of age. They do not reach the doctor. So a large extent of the patients, a huge amount of patients are being missed just because of the age, because of this consideration that the symptoms are because of the age. But and as I said, that since we are our population is aging, this is going to expand.
So you just mentioned in the beginning that these days we see younger generation also getting affected by Alzheimer's. So what is the reason?
There are two aspects to this. Number one, there is a genetic component which is there. So the genetic Alzheimer's disease can start at the age of 45 to 50 and it progresses from there. And the second point is that not just Alzheimer's disease, if a person has depression, if a person has a lot of stress, if the person is under a lot of tension and he is not able to concentrate on things, they have this symptoms which are mimicking the Alzheimer's disease. It looks like Alzheimer's disease. They feel that I am not able to recollect what I have done. Everyone feels that I forgot where I have kept my keys. I have forgotten where I kept my mobile phone. So that is because we were thinking about something and we have kept something at some place. So those things can also be ruled out. That also has to be ruled out. And that is one place which is where people come to us that, so we have got Alzheimer's disease, what to do? We are just 40. So, but they don't have Alzheimer's disease. They have something else. They have stress, they have depression, they have tensions, anxiety. So those things have to be also considered when we are dealing with a core diagnosis of Alzheimer's disease, especially in the young.
And how can we prevent it, sir?
Prevention to a large extent is a lot of brain health has to be taken care of. So there are foods like which can be taken, which can help. Pista, badam, those things can always help. Taking care of your own self, avoiding stress, avoiding anxiety, avoiding depression, difficult in today's world, but something which is going to help us, has to be done. And they have those brain games which can be done, sudokus and chess, card games that we used to play. All these are brain games that helps in keeping the brain fresh and active. So basically we have to maintain the connections of the brain, of the nerve cells which are there in the brain. So these games basically stimulate the brain, and that is how they help in keeping the brain healthy and avoiding these diseases.
So how crucial is the role of family members if somebody is suffering from Alzheimer's disease in the family?
You have a family which supports you. So this is the family which is going to take care of the patient. A patient of Alzheimer's disease is not an easy person to deal with because they do not know what they are doing. they'll not remember that they have to eat food, they'll not remember that they have to eat medicine. So all this has to be taken care of by the family. So the patient in fact is probably the less affected person and entity in this situation, because family is the one who has to take care of all these things for the person. So it is a very taxing affair for the family, for the caregivers of the patient. So they do need care, and they should make their support system. They should pull in their neighbors, they should pull in their friends, they should pull in their relatives, that yes, we have got a person of Alzheimer's disease, and they have to take care of themselves, they have to bring out time for themselves. So at that time there should be someone who can take care of the person, so that the daily caregivers can also take care of themselves and take care of their brain health themselves.
So lastly, what would be your message on World Alzheimer's Day today?
One has to take care of your brain health, one has to take care of yourself, and one has to avoid stress and anxiety. And if you feel that you have a memory problem, please do get to your closest doctor, please do get diagnosed early. Prevention and an early treatment is better in this condition, because as of today we still do not have treatment which is a curative one. There are things in the pipeline, but still we do not have a complete treatment. So it would be better that one comes to the hospital, one comes to the doctor as early as possible. Take care of yourself, that is the most important thing.
Thank you so much, sir, for giving us your time. It was a pleasure talking to you.
Thank you.